Rolling.
Okay. As you know, we've already put our PPE on. And what does PPE stand for?
Personal
Personal protective
protective
equipment. Very good. Yes, that's absolutely right. And why did we put it on? Because a lot of facilities will require that you apply personal protective equipment when handling and doing work with patients with communicable diseases, contact isolation, droplet isolation. And as you remember, our patient that we are taking care of has what? He's got pneumonia, respiratory, okay, droplet precautions. He's got MRSA in his urine. Would it be contact? All right, contact isolation for that. Plus he has an open wound from a surgical site that's infected. So another contact isolation deal there. And the nurse has asked you to assist her in a dressing change. Okay, so your job will be to roll the patient over and position him correctly for her while she performs a dressing change. After she is finished, she will remove her PPE and exit the room. You then reposition the patient and make him comfortable and empty the Foley bag, which is another contact isolation thing. And right? Yeah. And then and record your output. Now putting on PPE is a lot easier than taking it off. And it does get warm after a while. So what we're going to do today is we're going to start out with removing our gloves. Now remember, everything on the outside is contaminated. Your gloves, your mask. I don't have the mask on right now because I can't talk and breathe at the same time with it on. It's a little hard to do. So your glove, your mask, your gown are all contaminated on the outside. This fabric here is impermeable, so nothing can get on that inside. We start out by grasping the palm of our hand. Can everybody see me okay? Are there any questions so far? Okay. We start out by grasping the glove, the palm of the hand, and removing it. If you can get your hand out, sometimes it's difficult. All right. Here we go. Okay, keeping the glove in your other gloved hand. Take your fingers and run it underneath the other glove because it's clean on the inside, turning it inside out and disposing of it in a biohazard bag. That's what they look like. And usually in a residence room that has isolation, you'll have two bins in there, one for garbage and trash and one for clothing and bedding and things like that. After you've removed your gloves, it's time to remove your gown. Now remember, the outside of the gown is contaminated. Who knows what got splashed on it while you were caring for this person. First you untie it at the waist. Then you remove it from the neck, like this. Remember that it's contaminated on the outside. Roll it out inside out like this. And then the other one, you can touch the inside and then pull it out like that. Keep it away from you. Roll it into itself. Roll it into a little ball. And dispose of it in the red biohazard bag. Now to remove the mask. Remember, anything on the outside of the mask is contaminated. Anytime during this process you happen to touch your mask because you scratched your nose or you touch the outside of your gown, you need to immediately wash your hands and then start over. So to remove your mask is a relatively simple one. You just take your index fingers, grab the ear loops, pull it off carefully without getting your glasses caught in it, and depositing in the trash. There, and then you would wash your hands because sometimes gloves might have a hole in them. Anything could happen. Something could drip down the front of it or the side of it. You wash your hands before you leave the room. Okay, so what we're going to do is get into pairs. Okay, get into pairs. And then what I want you to do is one person will watch you take off your PPE and critique you in a way that's, oh, let's say you did scratch your nose, you did touch your gown, and then they'll remind you of that. Okay, then we'll do it vice versa. Is there any other questions on this? They're all clear? Okay, then let's get started. Plus, what do you do after you take off all your equipment and your gloves?
Wash your hands.
Good. All right, let's get started.